We just had another update in our Emergency Operations Center where, yet again, we can look at the map and we can see the red dots growing as the COVID-19 virus continues to expand around the country and in our region. In particular, you would see that the COVID-19 virus is expanding and people are getting infected coming up from the New Rochelle, Westchester hotspot into Fairfield County, where most of the folks who have been infected are located to date. That said, in an abundance of caution, most of the schools in Fairfield County have announced they will be closed for 2 weeks or for the foreseeable future. We got Miguel Cardona, our commissioner here, who will be able to answer more questions along those lines. One of the things he has done just to make sure that all of our superintendents of schools across the state have confidence, we're going to waive the 180-day requirement so that you have the flexibility you need to make the public health decision in the best interests of your communities. I think we understand what closing a school means to communities, what it means to businesses, what it means to families. And we're working very hard to make sure that this works for you. Starting with our small businesses and our businesses in general. First of all, we at the state government are doing everything we can to give our commissioners and managers flexibility in terms of where their people work. And I want to say the same thing to our businesses. You have the flexibility to make sure you know who has to be in the office, who doesn't have to be in the office, and to make those determinations. And for those folks who have to be in the office, Beth Buy is making a big effort right now in terms of expanding our daycare opportunities, just to make it easier for those, infants and toddlers as well as young people, give them alternatives where they can be while school is closed. We're trying to seek some waivers with our businesses, for our businesses, so they may be able to open some daycare and childcare at their facilities as well, just to make it a little bit easier for them going forward. I've heard a lot of folks worried that, look, if they show symptoms and they feel that they should stay home, and maybe they're living paycheck to paycheck, they're hourly workers, what type of protections will there be for them? And there we're working closely with our congressional delegation. You probably heard the president speak last night on this subject. Rosa DeLauro in particular is taking the lead on expanding our definition for unemployment compensation. So it includes sickness to make it easier for you to get compensation even though you're doing the right thing at that time if you have to take some time off to self-quarantine. I've heard from a lot of the small businesses who are worried and saying, look, I'm a service business. Service is down. If I lose 2 people, what does that mean to me? And David Lehman, our head of economic and community development, working closely with the Small Business Administration. We're going to be, over the course of the next week, being able to find how we can roll out our share of that $50 billion in very low-interest loans. You heard the president mention just yesterday. We're working at DECD in terms of the loans that we have put out there to make sure we can put off having to pay principal and interest. We're working with our banks as well, ways that we can maintain liquidity so that our small businesses know that they can keep going forward. We don't know whether this is going to be 1 month or 2 months, what the duration is, but we are planning for the future. I've got a couple of other executive orders that we've done. I mentioned the 180-day on the school year just to give our superintendents more flexibility. We do not want any more gatherings with more than 250 people, and that's going to be an executive order. This is highly infectious, COVID-19. And those groups, especially when they're standing close by, Susan, step away a little bit. We should be a few feet separated from each other in all of these public environments. I think 250 will be our limit. I'm recommending stay out of any groups of 100 or more. I just think that's a safe way to go and make sure that you're able to limit your exposure and others' exposure. And finally, Josh, Jabal, and I are trying to think of all the ways that maybe people feel like they have to go and interface with the government. The most obvious one is DMV, Department of Motor Vehicles. We hear that all the time. And while those lines are short and we're trying to get more people to be able to do this online, not inline, we're going to extend the duration at least 90 days for all renewals and the such, so you don't need to go to DMV for the near term. And we're going to be rolling out additional services like that provided by the state, so you don't feel the need to go in and congregate in areas where there may be a big group. Before I hand it over to Dr. Carter, I'd just like to say on a personal note, I've really been impressed with the people of the state of Connecticut, people stepping up, in particular the nurses, folks at the hospitals under a great deal of stress, more people, state employees and others raising their hand, volunteering, what more can I do? And we're going to be asking more of each and every one of you. We mentioned when it comes to daycare, when it comes to small business, when it comes to our hospitals and nurses and nursing homes. I want to thank you for going through this complicated time across the country. And I could not be prouder of the people standing with me here today and the professionals we have active. Dr. Carter?
Good afternoon. My name is Dr. Matthew Carter. I'm the state epidemiologist with the Connecticut Department of Public Health. Yesterday, as you know, I talked for some time about giving you a perspective about what's happening. This is a pandemic. It was declared yesterday. None of us have been through anything like this in more than 100 years. And I know that I was asked several questions that asked me to look ahead at where things were headed. I got several emails last night from people who said, "Did you really say that?" And I'd like to clarify. One of the things I want to clarify is that testing is very important. No one should think that testing is not. And every day that I go home, usually much later than this, I turn on the TV and there are multiple programs on television with people on one side saying we should have had a test a long time ago, and on the other side, tests arrive now. What I was trying to say yesterday, and I'm sorry if I didn't say it clear enough, is these discussions will go on for a long time. People will write books about this. But right now, this week, we have to make decisions about what to do with the information that we have now. Not the data that we're going to have next week or the week after this. We have to make decisions with what we have now. And up until this week, the only approved laboratory in Connecticut for coronavirus testing was the Connecticut Department of Public Health Laboratory. A fine institution, a great lab, but a reference lab. 5 people are doing this test and are doing all the testing for all of our acute care hospitals. This was a decision, a priority decision, a triage decision, because we need to test the people who are being admitted to our hospitals with pneumonia and or respiratory distress syndrome to find out if they had COVID-19 or not, because that's incredibly important information for our hospitals to have, so that we can protect our healthcare workers, nurses, doctors, respiratory therapists, and all the other people that make a hospital run. This week, both Quest and LabCorp, 2 large, perhaps the largest commercial laboratories in the country, started accepting specimens for outpatient testing with a physician's order. We have been working also with clinical laboratories at all of our acute care hospitals to develop the capacity for them to test at the hospital laboratory. We know that there's at least 4 or 5 that are far along in this process. Some have encountered difficulties ordering reagents that are necessary, because every hospital in the country is trying to do this and start this capacity. We expect that Yale New Haven Hospital will be the first online, hopefully in a few days. This will start to ease the burden for acute care hospitals. The most pressing problem that we have now, as I mentioned yesterday, is not the availability of a laboratory test, but the ability to get the throat swab and the nasal swab taken on the patient. And let me give you an example. 4 weeks ago, if you had a fever and a cough and symptoms of influenza, you would go to your doctor's office. Somebody would use the swab. They would make do a quick test and tell you have influenza. Now, if you have fever and cough and those symptoms and you call your doctor's office, you're being told, we can't test you at our office. Because fever, cough, those other symptoms are also the symptoms of COVID-19. And so primary care offices are not able to obtain the samples that they need. But at the same time, our emergency departments can't be places for these outpatients to test. That's why the focus has been on coming up with these alternate sites. We've asked our acute care hospitals to develop a way for people to go to the hospital with a doctor's order where they can be tested on the grounds of the hospital, but not in the emergency department. As you know, only one of those hospitals is in operation right now. Greenwich Hospital system is working. We anticipate another hospital to be online today. They will be announcing that. I won't be announcing the name of that hospital. And we hope to have additional ones in the next few days, because we need a place for people to be able to get these samples obtained in a safe environment. These samples will be going to our commercial laboratories. Again, with commercial laboratories, they'll accept it with a doctor's order. I'd like to also talk a little bit about test results, because as you know, our lab is running 3 shifts a day now to do laboratory testing, and can do between 40 and 60 people a day. Yesterday we had additional positive cases of coronavirus in Connecticut, COVID-19. We had one case of COVID-19 involving a resident of Stamford, who is a woman in her 60s, who recently returned from a trip to Italy. At Stanford Hospital. We have another case of a young woman in her 20s who was seen as an outpatient at Greenwich Hospital. She is a New York resident and is recovering at home in New York. Just so you know, the way cases are counted in the United States, it's based on their home of residence. So she will be counted as a New York State case, even though she was diagnosed in Connecticut. We also have a child who is a confirmed positive case. The child is a resident of Stratford who is exposed to a known case. This child is also home recovering. So far, our state public health lab has tested 95 patients. 65, we've had six cases that have tested positive. There are 4 from Fairfield County, 1 from Litchfield County, and 1 from New York State. That many of our specimens come from the rest of the state. None of the specimens in other parts of the state have tested positive for COVID-19 so far. These are the data that we have. It's not a surprise that this is really clustered in Fairfield County. Many of you know that the situation in Westchester County, New York, and New Rochelle, they have sustained community transmission. And we are seeing this move into Fairfield County. I'm sure there are people in Fairfield County, including someone who emailed me last night, who expressed concerns because she said, well, you said I should, if I'm sick, I should just stay home. And she said, is there even a point to staying home, or is it too late? It is not too late to stay home. This is only going to work if all of us together do what needs to be done to slow the transmission of the virus. I think that was the message that I was hearing last night when there were various, from Dr. Fauci and other national experts who were talking about this. These community mitigations will only work if we do them together. Thank you.
Any questions?
Could you give us some more details on what you're going to be doing for in terms of business assistance and individual assistance? I mean, are you talking about doing state loans? Lieutenant Governor this morning at Sanofi Protein Sciences mentioned the $5 million that have been approved in the bond commission, in the bond package, but it was never really clear what that money is being earmarked for. So could you give us an idea of what your administration and the legislative leadership is talking about and doing in terms of helping Connecticut businesses and Connecticut workers?
Thanks, Paul. So, as Governor mentioned, we've put Commissioner Lehman in charge of this emergency support function, ESF 14, I believe it is, which has to do with these related activities. He's got a set of initiatives that is being developed and we'll be sharing hopefully in the next couple of days. But as the governor said, some of those that we're confident we're going to be including have to do with companies that have received DECD assistance and giving some additional time and flexibility on repayment. Other programs where we know money is going to be coming from the federal government, and we're going to be working to ensure that gets funneled out to employers as quickly as possible. And there's other ideas in development. And then also, as the governor indicated, a big piece of this has to do with employees too. And for a lot of these small businesses, making sure that their employees have the supports that they need to be able to stay in their roles and keep the business going, even if they have related issues to COVID-19.
What happens with school lunches? 43% of children in our public schools rely on free public meals at schools. Other states have stocked their food banks. Is that something that Connecticut is doing? Or what's the state planning on?
I know that our school districts are the ones that have closed have in place contingency plans for this. So, for example, I know in Danbury and New Haven, they have plans established for how students will be able to come to collection points for food during the day to be able to ensure that they are getting the appropriate the meals that they need every day.
Dr. Carter, yesterday you said that this virus only lives for an hour on objects, and yet there were stories in every news site and every newspaper in the country from the Associated Press citing scientists who say it can last up to 3 days. This is in follow-up to my question about the package stores and beer distributors who apparently are now asking the administration to suspend the collection of empty bottles and cans for 60 days. Can you please address that again?
Oh, I'd be happy to. The report that I've read is that this virus, or fragments of this virus, can be found hours to several days afterwards. Now, remember, fragments is not necessarily an entire virus. And so it's important to point out that we actually don't have all the data about this that we would like. But what's clear, and as I talked about yesterday, this is not norovirus. Norovirus is incredibly hard to kill, stays on surfaces for months and weeks, and regular disinfectants don't work against it. That's not the case here. Cleaning and disinfection with standard disinfections will destroy this virus, which is why those are the key components to the public health strategy.
These small business owners can't be sure that this stuff has been cleaned. A lot of people don't clean out the bottles and cans when they bring them back.
But in terms of being a significant driver of this pandemic, the most significant driver are people who are coughing and sneezing. And environmental surfaces come into play and as you've already seen, some people in this building and in my building as well, people who come in and clean the table before they sit down. It's really, something. I do not believe that cans and bottles will be a significant source of infection for COVID-19.
The Chief State's Attorney has advised prosecutors when they seek bail to take into account the impact of the coronavirus. Is the administration looking at the early release of people who are now held on bail, or is that something that's strictly going to be in the hands of the judicial department?
Yeah, the judicial department is making their own decisions on those types of issues.
What about prisoner inmates nearing the end of their sentence? Is there any thought there as to?
I'd encourage you to direct those to the judicial department.
We have
Known as the
can we get
180-day
an
waiver
age range on that
statewide?
child in Stratford? Can we get the age range on that child?
I'll have to get that to you.
Okay, thank you.
Governor, don't you normally need legislative approval to change the 180 days, because that's in state law? Are you able to do this because of the emergency powers?
Correct.
Or what?
Correct.
Can you speak to that?
And it's statewide?
You just answered it.
It's a statewide waiver?
Yes,
It's going to be a statewide waiver. I want to take all ambiguity. Miguel was getting a lot of questions from superintendents, trying to balance that. It was pointed out to me that in the last couple of hours, we have 3 more folks who have tested positive for COVID-19.
The seniors in high school who are planning to attend college next year, will they have adequate education to get their high school graduation?
We're working on a variety of tele-education opportunities so they can keep going. And I think you're going to find other states will be following our lead on this, so they won't be at a disadvantage.
Governor, can you imagine a scenario in which you'd use executive action to close schools on a broader level?
We haven't had to. We've worked in a real collaboration with all the local superintendents. We discussed what we recommended in terms of what we thought was going on, and they either followed our lead or took the lead themselves because they know how important, public health is and what a contagion it can be in an environment like a school.
Could the commissioner speak to that and give us an idea of how many schools and how many school systems have actually taken this step so far in Connecticut?
First of all, I want to say I'm so impressed with the work of our superintendents, of our teachers to step up and do what's right for kids. As the governor mentioned, decisions about safety have to be made, and having this waiver for 180 days allows districts to make decisions based on student safety, which is the most important thing. But closing a school is a last resort. For many students, as was mentioned earlier, they get 2 meals in our schools. So we want to make sure that that decision is made based on input from the local health department and, if needed, the state health department. State Department of Education does not close schools. So that's a very important thing to point out. There are currently 19 districts that have either closed or are scheduled to close in the next day or two.
Dr. Carter, could I ask you an epidemiological question? How do you anticipate this expanding numbers of patients over the next 2 weeks? There's got to be some kind of math equation that you're anticipating, right?
Mm-hmm. And I'd actually like to start with the comments that Dr. Fauci from the NIH made last night, and which is, when this is all over, probably about 70% of our population will have had this infection. And this is between this wave and, if there's a fall wave, a second wave that we see in the fall. Because this is a virus that none of us have immunity to. Right now, we're trying to slow that down. What I expect to see in the next several weeks is continued spread into Litchfield and County and Fairfield County, Litchfield County and into New Haven County. We might well see a focus as well from either moving into the state from Massachusetts or Rhode Island. This is something that is going to change day by day. These are events beyond our control. Just like going back to the office yesterday at 5 and there's 3 more positive cases. And every day there's going to be new positive test results. And as the commercial laboratories get up and running, it's important. I want to mention, COVID-19 is a reportable disease in Connecticut. It's also a reportable laboratory disease in Connecticut. And we have electronic laboratory reporting with these labs. And we will get these reports electronically when they're available. And they will be included in our reports to you in terms of the number of tests that have been done.
My understanding is there's modeling on the spread of the flu because there's a lot of experience with that.
There are a lot of modelers trying to work on this one as well, using data from Italy and China and South Korea.
And is that helpful at this point, or is that still something you need to be further developed before you can rely on that sort of thing?
Well, right now we're looking at what happens in Washington State and California. There's no reason for us. There's several weeks ahead of us in terms of where this epidemic is for them. What we're trying to do is to slow this down here so that we can slow, how to say this clearly, we will be where they are at relatively soon. We'd like to slow that down if we can.
Can you put that in concrete terms for people in Connecticut? Looking at the Washington experience, and I understand there are other factors here, you guys are trying to slow it down in a way that Washington perhaps failed. But can you put that in concrete terms about what that spread rate would mean in a state like this? If you can.
Yeah. No, it's It's going to involve a little bit of speculation on my part. But I think in the next month, we may see 10 to 20% of our population get this infection.
Can you say that again on the 70? On the 70%, did you say 70% are exposed? Can you say that
No.
again?
I said before this ends, this is not going to be over in a month or two. What's expected is that there will be a spring wave that will, just like you're seeing in China and in South Korea, where the rates are starting to go down with their control measures, that we'll see this again in the fall. This happened with influenza in 2009. We had a spring wave and a fall wave, and then one the next spring as well. That's also what happened in 1918 with the flu. We don't know that that's going to happen for certain, but that's what we're planning for.
20% of the population is going to get ill, or 10
70
to 20 will be infected?
70% of our population is expected to have this illness before this is before this, if there are two waves.
So what the 10 to 20% figure, that's what I was asking.
I'd say in the next month to 2 months.
Connecticut's
Doctor,
population.
yesterday you said you didn't want to compare this to 1918, which is the
No.
pandemic to end all pandemics, so.
I said, we do not live in 1918. We have modern medicine. We have things that they did not have. They had no antibiotics. They didn't know viruses existed. They had none of the things that we have to be able to do this. The one thing that makes it similar is right now when we talk about school closures, closing movie theaters, those kinds of things, those were the same things that people were arguing about in the fall of 1918 in Connecticut, because that's what they had to deal with this.
Can someone speak to the impact of the school closures on the healthcare system being able to respond to this? And whether there's anything that the state can do to help?
I'm not sure I understand
You
the
know,
question.
children's parents are healthcare workers, so if they can't go to work, what
Healthcare
does that
workers
mean?
with children who are out of school is what
How,
she's asking about.
exactly,
Okay.
yeah, what's the impact, and is there anything the state can do?
I can tell you, I'll tell you what Beth explained to me, that we are prioritizing. Why don't you come and explain it to them?
Sure. Thank you, Governor. Thank you for that question. The Office of Early Childhood, in collaboration with ESF6, which is the group that's dealing with mass care, so that's with the State Department of Ed, with Department of Children and Families. There's a coordinated effort to look at this issue, Jacqueline. And in the current, today, we've been talking with the Hospital Association. They've been surveying their nurses and doctors about what their child care needs are. And we are, in collaboration with our licensing unit, looking for locations near there that can start up small child care programs. For the past 3 weeks, we've been encouraging parents, along with Commissioner Cardona, to create backup plans because we knew this was a possibility. I think parents have been doing that across the state. Additionally, starting today, 211 Child Care is reaching out to every child care program in the state to see if they're staying open or closed. And then we'll have an inventory. But that ESF, under the Unified Command, will be working cross-agency, public-private, to address those concerns. And organizations like the YWCA, ABCD, and Bridgeport it's going to be public and private working together.
Make sure I understand the school age, that population, is that just preschool age, or are we also talking about the older children?
Thank you for
as
the
well?
clarification. In opening the very small sites near hospitals and existing space, it would be small classrooms of infants and toddlers, a preschool classroom, and a school-age classroom, understanding that all of those ages need attention.
We have to wrap this up, but before we finish and I turn it over to the governor for some final comments, I just wanted to add my thanks that the governor started and Lieutenant Governor shared to our state employees who are raising their hands every day to take on new and different challenges to help address the need here. As the governor said, their safety also is a priority for us. That is part of the driving force behind the DMV changes that we're going to be implementing and some others that we're going to be rolling out at other agencies in the coming days. The other thing that we did yesterday and the governor referred to this morning in a radio interview was we rolled out a new policy yesterday that for our employees who are already participants or in the job classes that are approved for teleworking to give agency heads more flexibility to expand those teleworking opportunities as we look to get more of our employees working remotely within those jobs that can be done remotely. Obviously, there's a lot of jobs in this state you can't do from home. You can't be a state trooper from home. You can't work, be a corrections officer from home and so forth. But we're trying to ensure that we're taking actions to ensure that as many of our employees can participate in the social distancing efforts that we're looking to implement. So I'll turn it over to the governor to conclude.
I just want to, a lot of talk about 1918, a lot of talk about where this could go. I think you should understand there's some real differences here. I mean, first of all, we're paying attention to this. We've learned from China. We've learned from Italy, and we're taking real efforts right now to make sure that we hold down and contain this as best we can. And anybody who's feeling ill, not feeling where they ought to be, they should stay home. That's one way we contain this. Secondly, we're in a whole different world in terms of life sciences, bioscience, and where we are as a state. Connecticut is a leader on this. Susan and I just this morning were at a company called Protein Sciences. Protein Sciences, Meriden, Connecticut. They came up with vaccines that dealt with SARS in an effective way, dealt with flu in an effective way, and we're not going to have a vaccine over the course of the next 3 months or 6 months. But as Dr. Carter said, if there is a second wave on this, we are going to be prepared. And Connecticut is uniquely positioned, given the quality of our healthcare system, to take the lead on this. Thank you very much, everybody.